Hi, have a good day everyone, especially to Ma'am Gwendolyn. So today we're going to do informational or infomercial regarding the disorders or diseases related to endocrine system. So before I will move on, I will give a brief discussion or overview regarding the endocrine system. So endocrine system, as we know, that is made up of glands that produce and secrete hormones, chemical substances produced in the body that regulate the activity of cells or organs. These hormones regulate the body's growth, metabolism, such as the physical and chemical processes of the body and sexual development and function. However, there is several disorders or diseases that related to the endocrine systems, and this results when a gland produces too much or too little of an endocrine hormone called a hormone imbalance. The endocrine's feedback system helps control the balance of hormone in the bloodstream. If our body has too much or too little of a certain hormone, the feedback system signals the proper gland or glands to correct the problem. A hormone imbalance may occur if this feedback system has trouble keeping the right level of hormones in the bloodstream if our body doesn't clear them out of the bloodstream properly. So, one of the disorders that related to our endocrine system, firstly, is the gigantism. So, as we all know already, what is the gigantism? Is a serious condition that is nearly always caused by adenoma, which is a tumor of the pituitary gland. Gigantism occurs in patients who had excessive growth hormones or oversecretions of hormones in adolescence or in childhood. So, the pituitary tumor cells secrete too much growth hormone, leading to many changes in the body. The main symptoms associated with gigantism is large body stature with increased height compared to peers. Muscles and organs may enlarge as well. So the other symptoms of the gigantism include the delay in puberty, enlargement of heads and feet, physical changes in similar to patients with acromegaly. So the gigantism and acromegaly is almost similar, but which is gigantism occurs in the adolescents, while the acromegaly is occurs in the adulthood people. So, um, next is the abnormal enlargement of the hands and feet, widening of distal fingers and toes, called the paddle toes. Hands feel like a soft broth dough, and then changes in facial features, which can be quite prominent, enlarged forehead and jaw, pronounced underbite, and spreading teeth, enlarged tongue, nose, and lips. Deepening also of the voice in males, skin changes, increased number of skin tags, oily skin, excessive sweating, increased tissue in the wrist can lead to nerve compression, which may cause carpal tunnel syndrome, arthritis, and headache. So that's all about of the gigantism. So now let's proceed to acromegaly. So acromegaly, I've already mentioned a while ago, it's almost similar with the gigantism. Acromegaly is a disorder that occurs when our body makes too much growth hormone. Um, it's occurs this one is in adults people. So too much of this hormone causes bone, cartilage, body organs, and other tissues to increase in size. Common changes in appearance include enlarged or swelling nose, ears, hands, and feet. So what are the symptoms of acromegaly? So same also in the gigantism. Firstly, hands and feet become larger and swelling. You may notice a change in a ring or shoe size, especially the shoe width. Lips, nose, and tongue become larger. Bone changes, brow and lower jaw jut out. Bridge of the nose gets bigger and space between teeth increases. Skin becomes thick, coarse, and oily. Sweating and skin odor increase. Voice becomes deeper. Skin tags small, usually flesh-colored growth of skin that have raised surface may get larger or darker. And then the next one is the pronatism, elongation and widening of the mandible. So that's for acromegaly. And the third one is dwarfism. So it's a short stature that result from a genetic or medical condition. Dwarfism is generally defined as an adult height or estimated of 4 feet or 4 feet and 10 inches or 147 centimeter or less. The average adult height among people with dwarfism is 4 feet or 122 centimeter. Some people prefer to term or short stature or little people rather than dwarf or dwarfism. So it's important to be sensitive to the preferences of someone who has these disorders. Short stature disorders do not include familial short stature, short heights that's considered a normal variation with normal bone development. So the disorder usually results in the following. First, short arms and legs, with particularly short upper arms and upper legs. Short fingers, often with a wide separation between the middle and ring fingers. Limited mobility at the elbows. Disproportionately large head with a prominent forehead and flattened bridge of the nose. Progressive development of swayed lower back. Progressive development of bowed legs. An adult height around 4 feet or 122 centimeter. Small genitalia and delicate extremities. So these are only the several disorders or diseases related to our endocrine system. So now I will give to the floor to my partner to further discuss about the disorders or diseases related to the endocrine system. So I will give to the next person who will discuss these disorders. So thank you and have a great day.